So by far, one of the biggest stories today, promising news from Pfizer that one of its COVID vaccine candidates appears to be very effective.
We have good reason to think that science is going to defeat this virus over the next few months.
So joining us to work through this, Doctors Isaac Bogosh and Zane Chagla, two infectious diseases specialists. Hello to you both. Hey, we actually get to talk about good news. So that's a bit of a change of pace, which is nice. Dr. Bogosh, I want to start with you because this notion that this vaccine could be 90% effective. I mean, can you explain what does that actually mean and how did they arrive at that number?
Sure. So this is a clinical trial. And what they did was they prospectively enrolled over 43,000 people. So 43,000 people basically had a 50-50 chance. You either get the vaccine or you get a placebo. And they followed these people through time. Now, during the course of the study, 94 people had COVID-19. The study's not done. This is just an interim analysis of those first 94 events. And what they found is of those 94 cases of COVID, 90% of people did not get the vaccine. So said another way, the vaccine was pretty protective. If you got the vaccine, you had a far lower probability of getting COVID-19. The study's not done. They're still going to conduct the study. This is just an interim analysis, but the interim analysis looks pretty promising.
Right. And so, Dr. Chagla, I guess the follow-up is, how confident are we that we're comparing apples to apples in the sense that the trial of more than 40,000 people is reasonably representative of how the vaccine would work in real life?
So on the plus side, there was a variety of ages that are included up to the age of 85, which is really representative of the adult population. There are apparently a number of minorities that are included in the trial, but these are generally healthy people that were involved in the trial, devoid of comorbidities, cancer, transplant, the need for immunosuppressing medications, pregnant women. And so, as you roll out to the general population, you do have to be careful. That 90% number is really impressive in this clinical trial if it does stay going forward. But in the real life population, we may not get that number 100%. Does that mean that this vaccine's off the table? Absolutely not. But we do have to have expectations that there may be populations that won't react to it as great as seen in this trial.
Right. So even given what you've just said then, I mean, and Dr. Bogosh, I mean, I don't want this to sound like a reckless question, but why can't we then just get the vaccine out now based on the preliminary results, especially if you consider that, I mean, literally thousands of people die of COVID every single day. Like what side effect could possibly be deadlier than that?
So I think it's important for the study to continue and for independent government bodies. So for example, in Canada, it's Health Canada. In the United States, it's the FDA, to evaluate and pore over all this data, completely independent of any political interference. And they're going to look at all the data. They're going to look at the efficacy of the vaccine. They're going to look at the side effects. And they're either going to give it a thumbs up or the thumbs down. The thumbs up meaning, yep, it's okay. And if they do give it the thumbs up, it's likely that we'll start to see vaccine rollout shortly after, as we're preparing for. If they give it the thumbs down, then we're just going to have to wait until another vaccine rolls around, which, of course, we know there's several that aren't far behind.
Right. And yeah, so the rollout could happen very soon if everything sort of continues to go well with this. And Dr. Chagla, the plan for Canada is to get 20 million doses in the first 3 months of 2021. That's the deal that the government has set up with Pfizer. How does that actually play out on the ground in terms of like who gets it, where they get the vaccine? Is it like the flu shot, that sort of thing?
Yeah, so I mean, the one major drawback to this vaccine is that it has a significant cold chain requirement. So in other language, it needs to be stored at -70. A commercial fridge or freezer stores at -20. And so you really have very specific needs for this vaccine in terms of how it's distributed. It may not be in a family doctor's office or a pharmacy. You may need a centralized place to store the vaccine and take it to people. In terms of a rollout strategy, though, NACI, our Federal Commission on Immunizations, has come up with a strategy that prioritizes, obviously, those at the highest risk, so the elderly and those with comorbidities, people that need to care for patients, or so healthcare workers, people in long-term care, and people in households of people that have these comorbidities, and then starting to roll it out gradually to the generalized population if the vaccine data shows that the highest risk populations also have the highest or reasonable benefit here, I think that prioritization scheme works very well. And hopefully that's the target for the first 10 million doses.
And let me ask you, do you think we'll actually get that many doses in the first 3 months of 2021?
I mean, production is production. It takes time, but hopefully, again, even if it rolls out slowly, we can at least start focusing on that first group. So
Right.
even anything is better than nothing.
Dr. Bogosh, one last question for you, and I want to ask this in just an anecdotal way. I mean, I've heard from people who, even people who believe in vaccine science, they're maybe hesitant about getting the very first vaccine that rolls off the assembly line, so to speak. Yeah. What would you say to that person?
Well, I think it's more of a strategy, and I think we should be having a very strong PR approach right now, basically informing Canadians in an age, language, and culturally appropriate manner that vaccines are rolling out soon, that we should be prepared for them, and really to focus on what the vaccine's going to do, what the potential side effects are, and what we can be prepared for in the months ahead.
Okay. Hey, Dr. Bogosh, Dr. Chang, we got to leave it there. Thank you so much for your time. I really appreciate that.
My pleasure.